Students, today we shall discuss about the menstruation. We shall discuss about what is menstruation, how it occurs, it is the mechanism of menstruation, different phases, etc. First, what is the menstruation? The definition of menstruation. So, it is a phenomenon of cyclical discharge of blood. There will be discharge of blood which would be encyclically, and with association of the blood there will be mucus and cellular things, sometimes a dead ovum from the uterus. And how it would be discharged? It would be discharged per vagina, from whom it would be discharged? From the sexually matured woman, not small girl, not aged woman, sexually matured woman. When it will occur? It will occur in her reproductive life, when she can produce a offspring. This reproductive life is from menarche to menopause. So what is menarche? Menarche, when her menstruation starts, it is the menarche. And what is menopause? When her menstruation permanently stops. Stopping for 1-2 months will not do. Permanently stops. That is called menarche. It occurs within the intervals of 28 days. It may be plus minus 2 days, okay. 3-4 days also okay. No problem. 2 days earlier, okay. 2 days later, it is also okay. This cycle lasts for 20 days but may vary from 21 to 35 days. In this period, if it occurs, okay, not that much problem. Now, what is the duration? How many days there will be menstruation? Days is 3 to 5 days, but it should be anything between 2 to 7 days. If it is more than this or less than this, it is not good. So, what is the amount of blood loss? Amount of blood loss is around 20 ml to 50 ml between these. So, menstruation generally absent during some period. What is those period? Before puberty, until and unless the girls reach the puberty. What is puberty? That is permanently she start menstruating. During pregnancy, menstruation does not occur during pregnancy. And when the mother gives milk to the baby, then also menstruation does not occur. And after menopause means when the menstruation permanently stops. Now, we shall discuss the different cycles of the menstruation. First, uterine cycle. Here, the endometrium, you see here, it is the endometrium. It is graphically, it is shown. Endometrium. There will be change of the endometrium during the uterine cycle. It starts during the onset of menstruation, from here. You see from here, the onset of menstruation starts. And it ends in the recurrence of a next menstruation. When the next menstruation will come, it will stop. This cycle consists of the following phases. Number 1, menstrual phase. Menstrual phase lasts from 4th first to fourth days, maximum fifth days. Uh, it occurs if the ovum is not fertilized. Ovum will come from the ovary and it will reach in the maybe fallopian tube, maybe in the uterus. If at that time the sperm comes and becomes fertilized, then it would be zygote would be formed and menstruation would be stopped. If it is not fertilized, if sperm does not come, ovum do not get any sperm, in that case it will continue, menstruation will continue for the next. And it will occur after degeneration of the corpus luteum. Now, the next phase is post-menstrual or resting or regenerative phase. See, it is this phase, regenerative phase. And it lasts from 5th to, you see here it is 5th to 7 days. Here regeneration start, and it starts immediately after menstrual flow. Menstruation is complete on 5th day, and after that it starts. Now the endometrium heals and becomes normal and show the proliferative changes. Here you see the proliferative, it is proliferating, it is going up, proliferative changes is there. Here the endometrium which was torn at the time of menstruation, now it heals and show proliferative changes. It starts beginning proliferative changes. Now the proliferative phase. Proliferative stage, it starts from 7th to 14th day. Here you see it starts from this part to 14th day. Ovulation would be on 14th day. Regeneration of the endometrium occurs from basal layer under the influence of estrogen and ovary. These two hormones plays a part to do the proliferative phase. Estrogen, which comes from the ovary. There is a rapid proliferation of the cells. You see here, it is proliferating, it is becoming thick. Rapid proliferation of cells in the epithelium and stroma. So the endometrial thickness is increasing, and the glands inside this becomes enlarged. Now come to the secretory or premenstrual phase. Secretory or premenstrual phase is this phase. Here it is, secretory or premenstrual phase. Here. After ovulation, large amount of progesterone comes. It is secreted by the corpus luteum. This hormone with estrogen acts as a estrogen pine endometrium to convert the secondary type, a secretory type. Here it plays 14 day to 28 day. This plays. Now come to the management of menstruation. You have to give proper education to the girls. They should not fear. Menstruation is a normal thing of life. It is like other physiological processes. You have to make them understand. We pee, we defecate, tear comes. We take breath. eh? These are all normal physiological process of life. So menstruation also like that. It is a normal physiological process. Menstruation is not a dirty thing. In our villages, mother, uneducated mother teaches the girl that it is bad thing, it is poisonous, it is very dirty. No, it is not like. It is as pure as the blood. Nothing poisonous is there, no poison. It is as pure, it is just the blood from the body is coming out. Nothing poisonous. You have to teach the girl. It is not any noxious substance. It is a normal physiological manifestations. In the you have to teach the girls. You have to carry all normal functions. Don't play, don't learn, don't go to the school, don't pray. You have to sleep in the floor. It should not be like this. Nothing is there. She can do all normal physiological process like bathing, playing games, but the personal hygiene should be maintained. What she will wear, the pad, it should be sterile. In market now sterile pads are available. If she is poor, cannot purchase the sterile pad, then she will clean the cloth. She will dry it in the sun. After that, she will wear it. Sanitary pads. But in regular intervals, she should change it. It is not that the wet pad she will wear for a long time. If they are healthy couples, they can take sexual intercourse also. No harm. Nothing will happen if they do sexual intercourse. So students, we have come at the end of the menstruation. I hope you have understood the menstruation properly, and when this type of patient will come to you, you can give them proper teaching and you can treat them properly. Okay, thank you very much for watching the class. See you again in the next class. Until then, bye bye.